Thank you. So I'm Fran Visco. I'm a 30-year breast cancer survivor, and I'm the head of the National Breast Cancer Coalition, and we're a grassroots organization, a coalition of individuals and other organizations from across the country that focus on our mission to end breast cancer. And we have a focus, one focus is on educating our constituency about evidence-based decision-making, about research, and about clinical trials, and making certain that they're able to be involved at every level of the research process. So our community gets involved, or the community with whom I interact gets involved in clinical trials and in laboratory research, primarily when they enroll in trials because they are high risk or they've been diagnosed with disease. So these are often sophisticated consumer advocates, and they understand how any information they can get from research can help them. Now, everything to us comes from this fact that we believe that we own the biospecimens being used in research. They come from our bodies, and we're partners and participants and not merely data donors in this entire process. We believe in and educate about the importance of participating in research that will have benefit beyond an individual. Now, to decide whether to participate, it's important to trust in that process and that system when it can affect you, but even more so when it's unlikely to be of personal benefit. And transparency is a key component of trust. Having access to individual and aggregate results of research is extremely important to transparency and trust, as is having access to raw data. But I believe that's not within the scope of this discussion. In breast cancer, much of what we find out from genomics is not at all clinically helpful at present, but we still want to know it. It may be helpful in the future. It may be that there are possible actions you can take, but they should be unacceptable. BRCA tests outside of research protocols when your choice is to cut off healthy body parts once you have that information. Not directly on point, but for example, getting tumor profiles from Foundation Medicine and the like. Much of the information is not actionable, but the biomedical field and the media have such a focus on technology at the moment that they tout its existence and market its premature use, for example, the idea of personalized medicine. So our community is a part of this conversation and understands many of these issues. Now, we believe most of the issues surrounding return of individual research results can be addressed through the consent process, and that it should be an opt-out rather than opt-in approach. We should expand the field of genetic counseling so that results are returned with the option to interact with a counselor. And perhaps any donation of a biospecimen should involve interaction with the counselor even at the beginning of the process. But the timing of the release of this information is important. Unless there's an urgent clinical need, results should not be released until the aggregate results are analyzed and reviewed so as not to interfere with the research itself. Of course, as an aside, that's not the case with access to raw data. Now, we need to foster a culture where the lay public understands science, not just its successes, but also its failures and limitations. It's quite possible for most people to understand these issues, and we should stop assuming that they cannot. Women and their families came to accept the issues surrounding testing for predisposition to breast cancer, even though many of those questions are still unanswered. The public uses direct-to-consumer genetic tests more and more frequently. At MBCC, we spend many resources on education and training programs for lay advocates who represent a constituency in an attempt to help our public analyze scientific information, including genomic results, to demystify the science. You know, I was struck when I was preparing for this by the discussion around CLIA-certified labs. No biospecimens should be evaluated in a lab that does not meet the highest standards. This research whether it's going to be individual research results that are returned. This research has impact on people's lives, otherwise why is it being done? And it should not be left to labs that do not meet high standards. Whether that means clear or not, I cannot say, but it should be with the highest quality control. So for us, it's a given that the information should be given to individuals unless they opt out and say they do not want it. And the system should be built to accommodate that fact. And of course, at any decision point in developing and implementing this system, we must include appropriate patient advocates. Thank you.